The voices that you've just heard are Jimmy and Alison. They are amongst the first young carers that I ever interviewed and ever got to know, and that tape is 23 years old. I interviewed Jimmy and Alison in the early 1990s. They will now be in their late 30s, and they may well be in this room today, but I have no idea really what has ever happened to them. The story I want to talk about in this TED Talk is about children who are carers, children who are looking after parents and other family members who have some form of illness, disability, mental health problem, drug or alcohol addiction problem, or any other condition which requires someone in their family to look after them, to provide care, to provide support and supervision. There are 3 million children in the United Kingdom who live in families with illness or disability. There are 2.5 million children in the United Kingdom who live in families where parents have enduring mental health problems. There are 1.3 million children in the United Kingdom who live in families where there is alcohol misuse by parents, and then 500,000 where there is drug misuse by parents. Millions of children in the United Kingdom and around the world are living in families where there are severe circumstances, and these children are having to take on a caregiving role, like Jimmy and Alison. And there will be young people in this audience today who have had a caregiving role in their childhood and who may have a caregiving role whilst you're students as well. So how many children are there like Jimmy and Alison? The official figures suggest that there are around 200,000 children in the United Kingdom who have a caregiving role. We get that figure from the Census. This is a figure in which parents who complete the census tell us that their child is a carer. And of those figures, from those figures, we know that there are approximately 40,000 children in the United Kingdom who are caregivers under the age of 12. These are children, 40,000 children, who will be going to primary school, many of whom will have started caring from the age of 5, and who will probably continue to care right throughout their childhood, and some of them into adulthood. And of those 40,000 children who are at primary school who are carers, 4,000 are providing over 50 hours of care a week. That's according to their parents completing the census. The census underestimates the true extent of caregiving in the United Kingdom. It underestimates it because it relies on parents, if you like, admitting and being willing to fill in a form that acknowledges that their child is a carer. And because of that, I've always thought that it would never really count the true extent of caregiving by children. So a few years ago, I worked with the BBC to try and find another way of more accurately identifying and counting the numbers of children who would be carers in the United Kingdom, and it is a method that's now being used all around the world. And that method is very much more direct. We simply go to children themselves and we ask them, do you do any caregiving? And we give them a list of the kinds of tasks like you heard Alison and Jimmy talk about. Do you do intimate care? Looking after a parent, bathing them, showering them, helping them to the toilet, maybe feeding them? Do you do other tasks like keeping an eye on them, having to stay in to make sure that they're all right, that they don't harm themselves or harm other people? Do you do the cleaning, the cooking, the shopping? Are you the buffer between your family and the healthcare services and social workers and all the other bureaucracies and systems of the welfare system? And when you ask children directly, do you provide care, you get a totally different figure from the official census. So the census tells us 200,000 children are carers. That's 2% of all children. But when you ask children directly, do you provide care, what you find is a different figure. You find that 700,000 children, that's 8% of all children in the United Kingdom, declare that they're not just doing caregiving, but they're doing the most intimate and personal caregiving. The showering, the toileting, the bathing, things like that. And then if you add on top of that the numbers of children who are doing other tasks, like supervision and negotiating the welfare systems and the bureaucracies and looking after the household budget, you find that that figure climbs up to almost 1/3 of all children. That's, again, nearly 3 million. So what we do know is, if you just took intimate personal care as the closest proxy, the most extreme form of caregiving, you are talking about 700,000 children in the United Kingdom. And around the world, that is a similar figure. From the countries that have done research, we know that it's around about 4 to 8% of children are caregiving. When I started my research on young caregivers 24 years ago, when I spoke to Jimmy and Alison, it was a very difficult situation. And the stories that Jimmy and Alison told us have been repeated countlessly over the last quarter of a century, from surveys and from other qualitative pieces of work. And this TEDx talk is not a talk about depression, it's not a talk about this is such a terrible situation, aren't they poor things? This is a talk really very much about how we can change the world. How we can change the world locally and how we can change the world globally by involving ourselves as students, as academics, as citizens in important matters that affect millions of people, like young caregivers or any other group of children or adults in need. When I started, it took us a year to do that piece of work, and it was all done locally. And now, as the years have gone on, it's much easier to find young carers because we all know much more about it. The fact is that probably most of you in this audience and listening to the broadcast will have heard about young carers, and that's because we've had lots of research and lots of programs on young carers. The United Kingdom leads the world in terms of responses and awareness about young carers. We are the first country to engage in it in terms of research, and we are the most developed in terms of services and responses to young carers. So there are at least 350 dedicated young carers projects across the United Kingdom which are working with tens of thousands of children like Jimmy and like Alison. And we lead because most other countries in the world have not yet identified the issue of young carers as a cause for social concern. So that if you go to any other country, apart from Australia and New Zealand, you are going to find that they know very, very little about young carers. In the United States, they have estimated that there are 1.3 million children who are providing care to other family members, and there is only one dedicated project for young carers in the United States, which is in Boca Raton in Florida. Most young carers around the world are ignored and are invisible. When I was a child, I helped to care for my grandmother. I lived in effectively a one-parent family, and my grandmother had Parkinson's disease, and I helped to care for her with my mother. That experience throughout my teens was very powerful, but I didn't realise how powerful it was till I came to start to do research on young carers in the early 1990s. My first study in Nottingham, I was asked, would you be interested in doing a piece of work on young carers? And I had no idea what they were. I couldn't get my head around this notion of children providing care to other family members. But when I did get my head around it, and I got the grant, I realised that that was something that I had done in my childhood. And now when I reflect on my own experiences and my own development, I realise that that's had a major influence on who I am and what I have become. And what I want to say effectively in the last few minutes of this talk is that the issue of young carers is an issue about social justice. It's an issue about vulnerable children whose lives are restricted in some way because of having to provide significant, substantial and regular caregiving roles to other family members. But there are millions of children around the world who live in adversity, who live in difficult situations, not just because their parents are ill or disabled or have mental health problems or whatever it is, but they may be living in poverty, they may be living in families where there is HIV and AIDS, they may be living in families with domestic violence, with abuse, with neglect, and so on. And I suppose what I want to raise in this talk is that I have tried to make an impact, to have an influence on the local and on the global through the conducting of social research as a social scientist. And my question is effectively is, what can you do? What can you do as students? What can you do as academics? What can you do as citizens, as listeners, whoever it is? What can you do tomorrow? And the answer to that must be, you can do anything that you want to do. You can take control. When I started that research, I had no idea about young carers, although I had been a young carer. You may think perhaps he's quite clever, assistant pro-vice-chancellor, professor, all of that. At A-levels, I got 3 C's. I would not have got into this university with those grades, and I certainly wouldn't have been able to get into this university today to become a professor and the head of the school in which I studied as an undergraduate. Okay? I am not exceptional. The fact that I can speak today is because I've had to do a lot of this, that I've had to learn how to do this without shaking. Just to let you know, I am shaking inside. But the reality is, I'm not exceptional. But what we can all do as individuals or through collective organisation is we can change the world. We can change individuals' people's lives by doing research, by speaking out, by telling their stories, like you've heard Jimmy and Alison's story. As an academic, my job is a storyteller. And I hope very much that through these TEDx talks and through hearing me talk about young carers, you too will be able to give voice to people whose lives are blighted, restricted, whose opportunities are constrained because of domestic, caregiving, or other responsibilities, or poverty, or injustice, because you can make a difference. I make a difference through social research. What will you do tomorrow? Thank you.